Well, good afternoon, everyone, and welcome. My name is Kaylin Dorhauer, and I work with the Montana Academic Progression in Nursing Grant here in Montana. And what the Montana APIN, also known as Academic Progression in Nursing Grant, is a grant that was funded through the Robert Wood Johnson Foundation in order to create strong partnerships between community colleges and universities to make it more efficient for nurses to transition to a baccalaureate degree and beyond. The Institute of Medicine recommends that we increase the percentage of nurses with a BSN or higher degree to 80% by 2020 in order to improve healthcare outcomes. Thus, the Montana APIN grant was made to the Montana Area Health Education Center in the MSU College of Nursing on behalf of the Montana Center to Advance Health Through Nursing, also known as Montana CAHN. This grant is a 2-year, $300,000 grant that was funded through the Robert Wood Johnson Foundation. So this is our first webinar with the Montana APIN team, and it is called Pathways to Nursing. And we're going to have several other webinars that we can share with everyone across the state in order to show them the importance of increasing our nursing workforce diversity in Montana. So, before we get started, I'm going to introduce each of our panelists to you all. We have a great set of panelists. First, we have Erin O'Connor. In the 37 years of her nursing career, Erin has lived in 8 states, raised 5 sons, and is the proud grandmother of 10. With a great curiosity about life and a love of learning, Erin has thrived on change. She cites a quote from Helen Keller as her motto: "Life is either a daring adventure or it is nothing." Thanks for joining us, Erin. We also have Mary Nielsen, who has been the nursing program director for the past 6 years at Missoula College of the University of Montana and also serves as the Health Professions Chair. Mary has 35 years of nursing experience and graduated with a BSN in 1978 from College of St. Teresa. Her greatest areas of expertise were adult medicine and surgery. She also has graduated with a degree in nursing management, MSN, in 1999 from Clarkson College in Omaha, Nebraska. She started teaching in practical nursing and added Associate of Science in Nursing in 2006. Mary also serves on the steering committee as co-chair of education for the Montana Center to Advance Health Through Nursing. Lastly, we have Dr. Wade Hill on our panel, and Dr. Wade Hill is an associate professor at Montana State University in the College of Nursing and came to the university in 2003 after he finished his doctoral studies at Oregon State University in Public Health. To date, he has spent over 20 years involved in nursing care and now focuses his work on research, teaching, and advocacy. He maintains an active program of research focusing on children's environmental health and spends a significant time teaching and mentoring students in research methods and epidemiology. Dr. Hill has been consulted for a variety of environmental research and advocacy issues at both state and national levels from organizations such as the Montana Department of Health and Human Services, Healthcare Without Harm, the Centers for Disease Control and Prevention, the Agency for Toxic Substances and Disease Registry, and the Environmental Protection Agency. So as you guys can see just from their bios, we have an excellent panel for our first webinar, Pathways to Nursing. So just a few technical details before our presentation begins. Like I said, all lines have been set to mute, and you may press *6 to unmute your line. And you also may type your questions into the sidebar to the right of your screen at any time during the webinar. There will be a question and answer session at the end of the presentation, so feel free to go ahead and type your questions throughout the webinar, or you can save them till the very end. All right, well now I'll let Erin O'Connor begin our presentation. Erin, please remember to press *6 to unmute your phone line, and you can go ahead and take it away.
Thank you, Kaylin. I'm really thrilled about this opportunity to share my experience of becoming a nurse and my feelings about the profession. I realize there are a lot of professionals listening in today, and I just want you all to know that I really targeted my presentation to those students who might be interested in nursing. And as they listen to my comments, I hope they'll be stirred to reflect on their own personal reasons for their interest in nursing and to think about the special qualities that they might bring to the practice. We'll start with a definition of nursing from the American Nurses Association. That's always a good place to start so we're on the same page. And it goes like this. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human responses, and advocacy in health care for individuals, families, communities, and populations. Well, during my career of 37 years, I was engaged at one time or another in all these forms of nursing. There were multiple opportunities for learning and growth, and I can think of few other professions that offer so much fulfillment and sense of meaning and purpose as nursing. And this is significant to think about because some research reports that only 20% of workers are happy with their jobs. I'm still passionate about nursing after all these years, but that passion evolved over time. Initially, I was just looking for a good job that would allow me, a single mother of 4 sons, to provide for my family. I'd always wanted to be an elementary school teacher, but there were no jobs for teachers in Michigan in the 70s. I considered nursing for its practical value. Job security, benefits, a good wage, and a flexible schedule, just what I needed to care for my family. With the help of Pell Grants and state assistance, I completed my associate degree in nursing in 3 years and began work in a hospital as an RN soon after. That was in 1975. I was 32. After 8 years of working, I could sense the opportunities that would open up for me with a BSN. Also, I could see that the profession was moving to establish a baccalaureate degree as the entry level to the practice, and I wanted to be on the forefront of that movement. So in 1986, I graduated magna cum laude with a BSN and a double major in holistic health and wellness education. I've been licensed in 4 states. I've worked in a wide variety of roles, from clinic nurse to director of nursing to private practice as a health educator, and then some. I'll be 70 this year, and I still maintain an active license. So nursing has a lot to offer, but it's not an easy path. Nursing requires intelligence, knowledge, and certain character traits to be effective for those entrusted to our care and to bring fulfillment for the nurse. It's both a science and art. Science is synonymous with knowledge, and those entrusted to our care will need you to know many things. So all those classes are really very necessary. You'll need to know how bodies work, how certain illnesses occur, how medications work. Your patients will need your critical thinking skills, your assessment skills, and all nurses are held to certain standards of competency in performing these skills and others. The science of nursing is its very foundation. But the art of nursing is its very heart, for it's in the delivery of those skills in a sincere, caring, and compassionate manner that helps activate the innate healing capacity of the ill person. One of the definitions of art in Webster's dictionary states the liberal arts, literature, music, philosophy, and so forth, as distinct from the sciences. Another definition refers to art as any branch of creative work. What comes to your mind when you think of art? Creativity, certainly. An expression by the artist of something personal. In my use of the term, the art of nursing, I'm referring to the nurse's individual expression of his or her unique, creative, and authentic self as a nurse healer. A nursing instructor in my beginning nursing classes introduced this concept as the therapeutic use of self. This concept became the framework for my encounters with those in my care. There's a level of awareness, both of self and of others, that goes beyond the ordinary awareness of day-to-day life when one is engaged in the therapeutic use of self. A nurse with the beautiful name of Dawn Freshwater has published a number of books and professional articles on nursing. Online, you'll find a 15-page article titled The Therapeutic Use of Self in Nursing, which she wrote in 2002. It's both a scholarly as well as a sensitive discussion of this topic. Freshwater talks at length in her books and articles about the importance of self-awareness and the development of a caring alliance, which is therapeutic. In one of her books, Freshwater says, gaining self-awareness is a vital aspect of professional development for all who work in the caring professions. In nursing especially, the ability to evaluate oneself affects all areas of practice, including direct patient care, working relationships with colleagues, and maintaining one's own well-being in the often pressured environment of healthcare. Another nurse educator, Judith Buchanan, writing for an online journal called Humane Medicine, a journal of the art and science of medicine, says, self-awareness is critical to understanding our interactions with others within a helping relationship. She goes on to point out that the quality of these interactions upon which those receiving our care base their perception of whether that care is effective or not, and that quality can be affected by the nurse. This is another aspect of the practice of the art of nursing. Earlier, I stated that I thought nursing was a profession that offered great fulfillment, meaning, and purpose. The key to reaping these benefits is found in the use of the most essential trait in the practice of the art of nursing, the expression of compassion. I like this uncomplicated definition of compassion in Webster's dictionary. It's described as sorrow for the sufferings of others, accompanied by an urge to help. The Dalai Lama refers to loving kindness, an empathic feeling accompanied by an act of kindness. We've all experienced both the giving and receiving of compassion. The practice of nursing offers endless opportunities to cultivate and develop compassion, and in so doing, enrich our own life and that of others. Furthermore, there are scientific studies that demonstrate the health benefits of compassionate caregiving. Self-awareness is essential for managing the stress of compassionate caregiving, or you could say that compassion begins at home. These topics of compassion, self-awareness, caring alliance, therapeutic use of self warrant much deeper reflection than can be addressed here. Perhaps you could have some class discussions to further explore how you see these topics relating to your own visions of nursing practice. If anyone is wondering about my own brand of nursing practice, I will say that, like my passion, it evolved over time. My practice became less of a job and more of a vocation, a calling. As I matured and became more self-aware, I became more aware of and sensitive to others. As I gained more confidence in my skills, I became more able to be present for and focus on my patients. But during this growth process that could only occur through time and experience, I think I was always motivated by compassion. And that was what seemed to matter most to my patients. My own art of the practice came through at times from drawing on my Irish heritage. I discovered that my sense of humor helped to put many people at ease and reduce their anxiety. I even sang to some folks to bring comfort and also a few laughs. And holding someone's hand or just touching their arm during a procedure seemed to reduce their discomfort and somehow empower them. And then there is the smile. Mother Teresa said, every time you smile at someone, it's an action of love, a gift to that person, a beautiful thing. You won't find how to smile in the nursing curricula, but it's probably one of the most important nursing behaviors you can engage. It conveys friendliness, warmth, and caring, traits that may be far more important to your patients than how skilled you are at changing a dressing or starting an IV. When done mindfully with compassion, a warm smile is a powerful healing tool. I enjoyed smiling at my patients as I was genuinely glad to be able to care for them. And then, in September of 2007, I personally experienced the benefit of being cared for by a nurse who was practicing her brand of the art of nursing, one who was knowledgeable in the science and technology of the care I needed, and who delivered that care with warmth and compassion. I had learned 4 days beforehand that I needed open heart surgery for a triple bypass. Though I had great confidence in my physicians, I was worried about being on the ventilator and not being able to communicate, especially as I'm very sensitive to many pain drugs. And I was worried that I might throw up with a tube down my throat, but the surgery had to be done. When I first became conscious that evening in intensive care following my surgery, I was looking into the most caring, warm, smiling face ever. It had an immediate calming and soothing effect on me. Next, Emily, the nurse, assured me she knew of my drug sensitivities and would follow any pain med with an anti-nausea treatment. Then she asked if I was in pain, and she gave the medications as she described she would. It worked. Her voice and her touch were gentle, and her manner was kind. That worked too. My anxiety began to subside as I felt that Emily was both competent and caring. Several hours later, when the ventilator was ready to be removed, Emily had gained my complete trust, and I was able to work effectively with her during this procedure. To this day, I still feel emotional when talking about this experience. From being a patient, I really learned about the art of nursing. To me, Emily's nursing care exemplified the therapeutic use of self, and I'll never forget that. But not everyone is like Emily, and we have to be true to ourselves. I laugh every time I think of this quote, and it goes like this: be yourself is about the worst advice you can give some people. So, nursing may not be for everyone, but for some it will be everything. It will be their life's calling, like it is mine. Thank you.
Thank you, Erin. You tell a very beautiful story. Well, now we're going to switch over to Mary. Mary, remember to press *6 to unmute your line, and you can go ahead and begin.
Can you hear me, Kaylin?
I certainly can.
Hey. Well, like Erin, I would first like to thank everyone for the honor of presenting today. And then I would just like to welcome the absolutely amazing and wonderful colleagues that I have the honor of working with in nursing. And I'd especially like to welcome the high school students who are here in interest in sharing our passion of nursing and possibly making it your passion in your career. So first of all, my presentation is going to focus on discussing the difference between the LPN, the licensed practical nurse, and the RN, or the registered nurse. And then I would like to share with you the pathways that are available for nursing education in the state of Montana. So first of all, LPN stands for Licensed Practical Nurse. A student graduates from a practical nursing program, takes their national examination for licensure, the NCLEX PN, and when they have successfully passed this, they are given the L, or the Licensed Practical Nursing title. The RN stands for Registered Nurse. The student graduates from either an Associate of Science nursing program or a Bachelor's of Science nursing program, sits for their national exam, the NCLEX RN, and when they successfully passed, earned the R, or Registered Nurse, as their title. The main difference between the LPN and the RN is education, their duties or responsibilities, and their scope of practice, which is what we're going to talk about next. Each state has a Board of Nursing who writes and enforces the rules, the statutes, and the regulations for nursing in their state. So these can differ from state to state. Montana has a state board of nursing that defines what the LPN and the RN is responsible for in education, their job duties, and their skills. In general, the relationships and the regulations, responsibilities that differ between the LPN and the RN is that the LPN is very much task-oriented. They perform the skills. The RN is responsible for seeing and managing the overall picture of patient care. In looking specifically at the LPN, they must always be supervised by an RN or other healthcare provider. This can be done in several ways, being based upon the LPN's training, experience, and competencies. One way is through general supervision. The RN or the supervisor provides guidance and is present while the LPN performs a task or an activity. Another way of supervision is direct supervision. The RN or the supervisor is on the premises somewhere within the building and is easily accessible, but does not have to be within the immediate area of the LPN. And the last type of supervision is what we call immediate supervision. The RN or the supervisor is not only within the building, but is visible and auditory to the LPN within the area that they're working. This could be like a charge nurse or it could be a team leader, but somebody is right there in the area of working. The LPN, by definition, provides care in a structured health setting for patients who are experiencing common, well-defined health problems with predictable outcomes. Now that's a huge sentence, so let's break that down and talk about what that means. To do that, let's use an example. So a patient goes to surgery for a broken leg, comes back to the floor and is assigned to the LPN. The patient begins complaining of pain. The LPN has a good understanding and can predict that if they give a pain medication, the pain is going to go away. That is a predictable outcome. But if a patient is admitted who has a heart that is beating abnormally, and a heart medication needs to be given to help put that heart back into its normal function, we cannot predict how that medication will work. We know what we want it to do, but there is no real predictability to a heart that's having complications. Therefore, that is not an appropriate assignment for an LPN. The supervision of the LPN can be done most of the time by an RN. But the other healthcare providers that can supervise an LPN are physicians of any type, a physician's assistant, or a dentist within whatever facility they may work in. So what does an LPN do? What are their responsibilities? First, they work in conjunction with an RN, meaning that they are a team and they work together. They can assist the RN or help in deciding what the care needs of that patient might be. And the LPN then can put into action, or interventions as we call them in nursing, the care that has been set up by the team or by the RN. The LPN also helps the RN decide if the care provided is the right care for the patient. They contribute to that plan of care. The LPN can administer IV therapy with appropriate supervision from the nurse or the other healthcare provider. They can also prepare and give many oral, injections, and IV medications that are not restricted for being given only by an RN. Fairly new within the last few years, starting in 2008, the LPN can now administer IV medications, meaning that they go through a tube or a port connected to the patient. They can be only certain medications, again with those predictable outcomes. They can observe the patient in reporting abnormalities to the nurse, meaning that they know what is normal and they report to the RN anything that is not the patient's normal. And then the greatest function of the LPN is that they perform the skills, meaning that they provide the hands-on direct patient care. Also fairly new, starting in 2008, the LPN can administer blood to a patient, but they cannot or provide that first 15 minutes of the assessment. That must be provided by an RN. The LPN can assign work to and supervise nursing assistants. And the LPN can be a charge nurse in a long-term care facility, meaning a nursing home, or some type of resident care. Regulations in this way for long-term care are changing, and if the long-term care facility wants better reimbursement, so in a way like being a 4-star nursing home, they do need to have the charge nurse role be an RN, and they have increased the percentage of RNs that must be working alongside the LPN. So that is a new regulation that has just within the last year to year and a half changed. So many nursing homes are going through changing from an LPNs to RNs. Now let's look at the RN and what is the responsibilities, or what does the RN do? First of all, they advance to their patient care in that it's not just the hands-on direct patient care, but it expands beyond the patient to individuals, groups, and their families. The RN is not only a team member, but now their role increases to be the manager of the team. They're like the team leader when there's multiple disciplinaries like physical therapy or occupational therapy involved. The RN also becomes like the gatekeeper in making sure that all the patient's needs are being met, and that they're being met efficiently, appropriately, and within a safe environment. The RN also assesses and determine what that specific patient's needs are. They have increased responsibility and autonomy. Words that advance the role between the LPN and the RN develop and manage, initiate, analyze, and the RN can administer all types of medication. These are not functions of the LPN. The RN also takes verbal orders, takes written orders, and can pass those orders on or delegate them to someone else. They are the charge nurse or the head nurse of units, and they are also responsible for prioritizing the needs of each patient, along with prioritizing what patient needs to be seen first, or which patient is appropriate to assign to the nurses that are part of their team for the day. It is also important to point out here that there are very significant and important differences between the associate degree registered nurse and the bachelor's degree registered nurse. And that's what Dr. Hill is going to be presenting to you in just a few minutes. The average salary of nurses, for the LPN, the average salary is between $20,000 to $50,000 per year. For the RN, it's $48,000 to $90,000 per year. Salary, of course, is based upon location and years of the nurse's experience. But what you can see from this is that the RN makes approximately double what the LPN does. Moving ahead to the education area of nursing, there are several pathways available for students in becoming an RN. And your goal should always be for that bachelor's level, but there are multiple avenues or ways that you can get there. As we learned from Erin, she started out as an associate degree nurse and then moved into getting her bachelor's. So the first level of nursing is the LPN. This education is 2 years, 1 year of pre-nursing general education courses and 1 year of nursing courses. At this point in time, the student has the option then to sit for their licensure, become an LPN, and work as an LPN, or to advance their education to the level of associate degree RN. An associate degree RN is 3 years of education, 1 year of general pre-nursing courses, and 2 years of nursing courses. If an LPN goes back to school to get that associate degree RN, they just usually take the pre-nursing courses that they need, and then they can just take 1 more year to become an associate degree RN. And the third way to becoming an RN is through the traditional bachelor's program. 4 years of college, and you graduate with a bachelor's degree in nursing. Looking specifically at nursing education in Montana, all practical nursing programs and Associate of Science degree nursing programs are part of the Montana University system, must use the Board of Regents mandated common curriculum. That means that all the pre-nursing general education courses and all the nursing courses are the same. They are taught in the same order. They have the same course numbers and course titles and the same course descriptions. This makes school transferability and advancing your nursing education more consistent and easier for students. Community colleges, private colleges, and four-year colleges do not have to follow the common curriculum, but several of them do. The next couple of slides here is what is the common curriculum in the state of Montana. In slides In this slide, semester 1 and 2 show the common curriculum pre-nursing general education courses. These 2 semesters can be mixed and matched to meet the student's needs, but they must be successfully completed before the student is admitted to an RN program. That is also true of the LPN who may have been educated several years ago and doesn't have some of these courses. They need to take those before they're able to apply to move into an RN program. These 2 course semesters can be taken part-time, but once a student gets into the nursing program, it's usually full-time schooling. Semesters 3 and 4, with the next slide, are the practical nursing courses for colleges that have practical nursing programs. For colleges with just associate degree RN programs, this is the first level of their nursing courses. With successful semesters 3 and 4, students are prepared to take their NCLEX PN licensure exam or advance to an associate degree RN program. The slide showing semesters 5 and 6 are the Associate of Science degree nursing courses. What's important to notice here is the nurse course titles. In semesters 3 and 4, or the practical nursing level, the word core is used. And then when you get to semesters 5 and 6, or the RN level, you see the word complex to describe the nursing courses. This reflects the increased knowledge and understanding required to be an RN versus an LPN. With successful completion of these semesters 5 and 6, students are prepared to take their NCLEX RN licensure exam. They can then work as an associate degree registered nurse, or they are prepared and ready to move into an RN to BSN completion program. That is the topic of the webinar for March, so I won't spend any time talking about that. Colleges in Montana that have practical nursing and associate degree nursing programs are listed here on this screen. They may have just one or they may have both. Colleges that do just the Associate of Science nursing degree are on the next slide. Some of these programs also have RN to BSN completion programs, which again will be discussed in March. The colleges that have the traditional 4-year Bachelor's of Nursing programs in Montana are Carroll College and Montana State University. That actually ends my presentation, and if there are any questions, I'll be happy to answer them at the end. So thank you very much.
Thanks, Mary. That was very helpful walking us through the pathways to nursing. All right, we're going to go ahead and get started with Dr. Hill. Just a reminder to press *6 in order to unmute your line. Are you there, Dr. Hill? *6 unmutes your line.
How about now?
We can hear you now. Thanks.
Yay! All right. Well, thank you very much for inviting me to speak today. As someone who's completely invested in our profession of nursing, I really feel a deep sense of responsibility to reflect on nursing as a career choice and what kinds of possibilities exist out there. I know we have a really varied audience, and so I hope some of my comments today will kind of touch on all of your interests, and certainly we'll entertain questions at the end. I also am mindful of time, and so if we get down to the point that we need some more time, I'll kind of rush through a couple of slides. So Second slide, please. Just to be clear, there are currently 3 pathways to becoming a professional nurse. And when I say professional nurse, I mean a registered nurse. Certainly you heard from Mary about pathways to include the LPN. But for registered professional nursing, you can go to a 3-year diploma program, and these are very much older programs. I don't think there are that many left in the United States, and they're usually hospital-sponsored, and we actually don't have any in Montana, so you'd have a far and wide probably to find one. The 3-year associate degree program, as Mary alluded to, and the 4-year baccalaureate degree program. And so what I'd like you to note, though, is that this is just entry into practice. This does not represent the world that's available to nurses for progression and differentiated practice. I think that there's a massive opportunity out there in many different specialties for advanced practice and for some really exciting things. And so although you can get to entry into practice any of these 3 ways, that's really just a starting point. And, specialty practice such as, family nurse practitioners or clinical nurse specialists in critical care and emergency care and public health or psychiatric care certainly are very interesting fields that require some advanced preparation. When I talk to prospective students, I always point out that entry into practice is just the first step, and there's so much of a world of opportunity that exists out there that I really believe that students should start with that mindset that this is only the first step in a long career of continuing to educate yourself in this field. Program differences. Students are sometimes confused about, and the public, in fact, is a little bit confused. What's the difference between an associate degree nurse and a bachelor's degree nurse? And that's the point of my today. In general, baccalaureate programs add more physical and social sciences, nursing research, which is increasingly important, public and community health, nursing management, and more humanities. So when a university gives a degree, they certainly have general university studies, and because you're getting a baccalaureate degree, there's a sense that you're a well-rounded individual that has knowledge in lots of different things. Certainly you specialize in nursing, but you're as an educated citizen, you know a lot about lots of different things. For example, I got a minor in religion when I went to the university after through my educational career. And let's not forget the very last point, and this has been so important in my career, that universities are fun. They just plain are. And I'm not saying community colleges aren't, because I spent my share of time there, but it's really fun to be at a university. We have, for example, at Montana State University, we provided student opportunities in the last few years to interact with, internationally known people. We've had Shirin Ebadi here, who's a Nobel Peace Prize winner, who championed the rights of women and children in Iran. Dr. Jane Goodall was here, and we had student opportunities with Dr. Goodall. E.O. Wilson, very recently, who's known as the father of biodiversity, certainly just on the coattails of Darwin in terms of understanding biodiversity and science. And most recently, we had Dr. Maya Angelou, considered to be one of the greatest American poets and educators, especially with respect to diversity. And so I want to point out that university education and universities are not all just about what we major in and what we study. They're also about developing people as human beings and about that well-rounded education. Next slide, please. So more education makes a difference. And this is, frankly, an assumption that we have, but I'll back that up with some data in just a minute. Most of our national nursing and healthcare organizations have come to the conclusion that our nursing workforce should be educated at the baccalaureate level. Most recently, in September of 2012, there was a joint statement by the American Association of Colleges of Nursing, American Association of Community Colleges, Association of Community College Trustees, National League for Nursing, National Organization for Associate Degree Nursing. So all of these groups got together, and in this historic agreement, decided that we should do everything possible to promote academic progression in nursing, and with an understanding that there's no value with a highly educated nursing workforce, and we should make that transition between our increasing skill sets in nursing easier and easier. In October of 2010, the Institute of Medicine published this landmark report, The Future of Nursing, and that was referenced earlier. Kaylin referenced it, calling for 80% baccalaureate-prepared workforce by 2020. And so, of course, as nursing educators, we're doing all we can to kind of facilitate that. In 2010, again in May, the Tri-Council for Nursing, so another 4 organizations got together and concluded that without a more educated nursing workforce, our nation's health will be further and further at risk. We know that we practice in a very complex and rapidly changing healthcare environment. In our nursing graduates and nurses need to be increasingly sophisticated to manage that healthcare work in that healthcare system. In December of 2009, there was a landmark Carnegie Foundation study. Dr. Patricia Benner recommended preparing all entry-level registered nurses at the baccalaureate level, and more than that, requiring all RNs to earn a master's degree within 10 years of initial licensure. And so the bar is rising, and I put et cetera in here because there is literally a list of 12 or 15 fairly recent national statements by influential bodies that recognize that the nursing workforce needs to become increasingly skilled to be successful. So why, next slide please, why is it important, why are these organizations and individuals making these statements? Longest time, I think, in nursing and elsewhere, we've kind of defaulted to the assumption that more education was better, but we didn't have good data to back that up. We didn't have outcomes data to support the idea that it's worth pursuing more in increasing nursing education. Increasingly, we've seen studies like the studies I'll reference in the next few slides, suggesting that there are significant differences and significant advancements when we educate a nursing workforce to higher levels. So in this study, and I cite at the bottom, you can look it up, surgical patients in magnet hospitals had 14% lower odds of inpatient death within 30 days compared to non-magnet hospitals. And although lots of things go into magnet hospital status, not just the status of the workforce, the author's conclusion were that the majority of these impacts were like a result of investments in their staff, including a much higher proportion of baccalaureate prepared nurses. And so I don't know what you know about you, but a 14% lower odds of death is a pretty significant drop in risk of mortality. And to the extent that that can be attributed to a better prepared nursing workforce, I think this is the type of study that suggests we need to start paying attention. Next slide, please. Another study found that for every 10% increase in the proportion of baccalaureate prepared nursing hospital staff, they saw a 4% decrease in the risk of death within those hospitals. And what's important about this study, science builds on itself. And this was a study that was published by Linda APIN in 2008, but it was a replication of a study that she had published in 2003 in the Journal of the American Medical Association. And that 2003 study actually found a 5% reduction in death, and that's after accounting for the acuity of the patient, so how sick people were, and even nurse-to-patient ratios. And so you may think to yourself, well, there are lots of things that contribute to hospital mortality. That is how sick people are when they come in, what kinds of patients certain hospitals get, how many patients that each nurse cares for, lots of factors like that. And what Linda Aiken did in these 168 hospitals, which is a really massive, important sample size, is control for all those and found that this reduction in the risk of death was solely attributable to baccalaureate preparation. Next slide, please. Other studies, such as this one cited by Fagan, have showed that patient care outcomes, such as fewer medication errors and fewer procedural violations, occur when you have a higher educated nursing workforce that is a more baccalaureate prepared nurse. These findings, published by Milbank Memorial Fund, were replicated in other studies, including some from Arizona and Colorado and Louisiana, Ohio and Tennessee, and really across the board that they find that medication errors and procedural violations are less frequent when you have a better educated staff. Next slide, please. Of interest to prospective students and nursing students is the idea that it may be easier and probably is easier to get hired after graduation with a baccalaureate degree. And so all things being equal, experience and location and nursing demand, there was a survey done, it's kind of old now in 2001, but they surveyed 80 chief nursing officers in a large health system, and 72% cited said that they would rather hire nurses with baccalaureate degrees and critical thinking and leadership skills as reasons why. And so, I think employment is also a concern, especially if you're one that's out seeking a job. Next slide. Let's see, I think that's a repeat. I think that's an extra slide. Next slide, please. So I want to close. I know we're close on time here, and I want to close with just a case study, and that's really describing my own career. I have a picture here, and this is myself with a master's student and 2 undergraduate students and 2 doctoral students at a conference in Boston. And it reflects what I really, really very much like to do anymore, which is teach and research. But I didn't always start out that way. When I was in high school, I grew up in Wyoming, and I received training to become a certified nursing assistant at a long-term care center in Lander, Wyoming. And this, in part, was a test to see if nursing was for me, and I have to say I learned a lot, and a lot of the experiences that I had as a CNA leave me even today with permanent smiles and even some really sad memories, and I think about that often. It turns out I did want to be a nurse, and as you've seen described in this webinar, I've been through every level of this. I went to Chardon College in Chardon, Wyoming for a year after my prerequisites, and graduated with a certificate in practical nursing and took the licensure exam. Subsequent to that, I went back to the nursing home in Westward Heights Care Center in Lander, and I was a nurse there. I went back to Chardon College and received my associate's degree and moved down to the university in Laramie, Wyoming. And I really felt very good about my nursing education at that point. I started working at Ivinson Memorial Hospital in Laramie, and I recall vividly my transition from an LPN to an RN, and the sheer weight of working in an acute care environment was, both thrilling and intimidating to me. I remember some of the fear quite vividly. The communication and management, time management skills that I learned as a CNA and an LPN were really invaluable. I felt like I hit the floor, outpacing a lot of the other new graduates that I was around, even those graduates from baccalaureate programs, because at that point I had a significant amount of floor experience. But it didn't take long to understand what I was missing. While I was finishing my bachelor's degree through a bridge program at the University of Wyoming, I learned that there was a lot more to nursing than starting IVs and pounding the floor for 8 hours. I recall the first time that research and evidence was really important to me in my practice. I worked on an orthopedic floor, and we were debating the use of blood thinning medications after hip replacement surgeries compared with other therapies that did not include medications in order to prevent blood clots after total hip replacements. And I was now a charge nurse, and my nurse manager assigned me the job of reviewing the literature and proposing a policy on this issue. That is, do we use, heparin at certain times, or do we do something else? And I was completely lost. I didn't have the skill set, and I recall at that point really naively combing through drug company literature in magazines and relying way too much on sources of evidence that were, in retrospect, quite suspect. I was lucky that this was a long-term project, and it coincided with my completing my bachelor's degree, and I finally received both the education and the mentorship to do a serviceable job with that policy. But in retrospect, I'm a little scared of what I would have done with that policy without my bachelor's degree preparation, because I just did not have the skill set coming out of my associate degree program. I've always said that the most potent learning experiences in my life have been random. That is, they're more related to being at the right time. And during my bachelor's degree, and this is one of the things about being at a university, I had the opportunity to work with a faculty member in public health, and I remember the day that I started to think about my patient being a population instead of an individual, which is it's a hard transition to make if you're used to caring for people one-on-one. And I thought influencing a change in a population has the potential to impact thousands of people. And I knew at that point I was taking a new path in my nursing practice. The promise of that ability to influence health on a very broad scale led me to complete my master's degree in nursing, focusing on community and public health, and then a PhD in public health when I went to Oregon State University. So I present my story to you as a case study, and in healthcare it's not always good to be a case study because it usually means you have some really strange kind of disease. And this isn't a disease, but it does illustrate the fact that you can go through every step. The point here I would make is that I believe no matter where you start, you should always have an eye towards that progression. And how can I get to the next step? What I do now, I am really interested in chemical exposures in children, and in hopes of influencing the health of those large groups of people. I spend my time doing research and speaking about it and writing papers, and I teach nursing students how to integrate research into their practice, and I try my hardest to encourage nurses to enjoy the broadest type of practice they can aspire to. And that includes really a starting point at a baccalaureate degree. And so thank you for your attention. I know we're short on time, and with that I'll close.
Thanks, Dr. Hill. All right, so now that we have everything wrapped up here, we had a couple questions that came through, and I understand if anybody has to get off the line, feel free to do so, but if you'd like to stay for the question and answer component, you're also welcome to do that. So one of the questions was, they're curious if our slides and webinar presentation will be available online after it's done recording, and the answer to that is yes. We'll have this webinar archived and available on the Montana CAHN website next week, and you'll also receive a link to that recording if you participated in this webinar today. And you'll also receive an invitation to our next webinar that will be held March 28th if you were a participant today. A couple other questions that we had come through, and I'm putting up the presenter contact information in case any of you guys want to directly contact Ari Marin or Dr. Hill. But first of all, we had a student that was curious, would you recommend that a student takes a CNA course before they begin college? And that can be open to anyone who'd like to answer that.
So can you hear me?
I can, Mary.
This is Mary, and the answer to that is yes. I think Dr. Hill did a wonderful job talking about the skills that he learned in being an LPN, and many nursing programs around the nation actually require that you be a CNA before you move into a nursing program. That is an absolutely excellent question, and the things that you'll learn as an LPN is that patient interaction, what it means to be involved with the patient and the family, time management, because you'll have multiple patients with multiple things to do, communication skills, teamwork. There's just an invaluable amount of lessons and skills that you will carry throughout your career that you will learn as a CNA. So very much encourage students to become CNAs before they go to school.
Thanks, Mary. I also have a question for Dr. Hill. What has it been like for you to be a male in what is a dominantly female profession?
That's a great question. And, in high school I was the president of our rodeo club, and I was on rodeo scholarship through college. My career choice was a little bit unusual for where I came from. But I have to say that, nurses are compassionate, and in my experience, and I've been all over, I've been really well accepted into the profession. You know, in certain areas, it's really good to be a male nurse. I work orthopedics, and I can tell you, if you're a 90-year-old lady with a broken hip, they oftentimes would rather see me come in the room to get them out of bed than, somebody that didn't have a male stature. And so I've had a wholly positive experience, and, there are stories out there where, men haven't always felt that way. But I can tell you that at every level in my nursing practice, I've been welcomed by female nurses, and I've just never felt like I didn't belong.
Great. We also have another question for you, Dr. Hill. Did you find that it was easier to be hired as a male nurse? Like, was there more need because you were able to meet those requirements?
I've never felt like I had an advantage in hiring. My wife and I went through our pattern all together, and when the job market for nursing is good, and you have, you come from a good accredited school, and you have experience, I don't think that gender enters into it. There are probably areas like obstetrics and things where there aren't that many men practicing, although I know in more metro environments that's not always the case. But I never felt like I had an advantage in hiring or a disadvantage, to be honest. I think it's been more, in my experience, market-driven. When they're hiring, they're hiring.
Perfect. Thanks. We have a question for you, Aaron. Was it difficult to balance having 5 children and raising your kids while going back to school and working?
It was difficult. But I think that our whole family benefited, actually. My family was a team, and all my sons know how to cook and do laundry and keep house and so forth. I don't think I could have managed that with